Hi, my name is Lisa Cuddy, and I will be talking about cerebral palsy. What is cerebral palsy? It's a group of disorders that affects a person's ability to move, maintain balance, and posture. It is the most common motor disorder that they have found in children. It is caused by abnormal brain development that happens before or after birth, or brain damage can cause this. Abnormal brain development can develop pre-birth while the child is still in the mother's womb, during birth, or after birth as the brain develops. Brain damage can cause injury to more than one part of the brain, so it may cause other impairments for the child on top of the cerebral palsy. There is no cure for it, and it's usually found within the first or second year of life. There are different types of cerebral palsy. Usually they're into two different categories to start. The congenital cerebral palsy, that is the part that develops before birth, or acquired cerebral palsy, that's acquired after birth, usually from an infection or a head injury. Maternal bacterial infections such as urinary tract infection can cause it, or neonatal bacterial infections. There are three types. Spasticity cerebral palsy, it is the most common that they have found. 80% of the children have this type. This is mainly in the legs. It has increased muscle tone, which makes the muscles very stiff and hard to move and painful. Dyskinetic cerebral palsy, this is uncontrollable movements. They might have a hard time sucking and swallowing if it affects the tongue and mouth. Muscle tone in this one can change. It can go from stiff to soft. It can change in a day, multiple times a day, or it can change day to day. The other kind is ataxic. This is a problem with balance and coordination. A child can have more than one type of cerebral palsy. The most common combination that they have found is the spasticity dyskinetic. I already spoke about the different characteristics, but to name them again, it is stiff muscles, uncontrollable movements. They may be slow. They might be rapid and jerky. There might be poor balance and coordination. They may have a hard time sucking and swallowing food. There may be other impairments such as sensation problems, perception, cognitive disabilities, communication. They might have behavioral problems, and their muscle tone may change. Treatments of cerebral palsy, everything will be diagnosed and talked through with the doctor. There are medications such as anti-inflammatories, antidepressants, muscle relaxants, nerve blockers. Those are just a few. Braces may be prescribed for the arms or legs. Surgery may be an option. It is not always. There will be physical therapy, occupational therapy, and speech therapy that could all be available to the child. Diagnosis and early signs of cerebral palsy. Some early signs are a floppy body, missed milestones such as rolling over. The diagnosis is, sorry about that. The diagnosis is done by a physician. The screenings are usually at 9 months, 18 months, and 24 months. They may do brain scans or CT scans if they are seeing signs of this. There will be questionnaires for the parents or caregiver, family members, anybody who has contact with the child to find out where the baby is developing. The doctor will keep track of this over the period of time as the child develops. The Individuals with Disability Act, IDEA. This is categorized under orthopedic impairment. So Part C is going to be for the early intervention from birth to age 3. This is where the IFSP will come into play. This will be established and provide help for the family and the child as far as resources, care, help, different things like that. Part B will be age 3 through 21, and the IEP will be established through a team. And this will focus on the child's goals that will help develop things that are needed in the school setting. It can help develop things that they should do outside of school, job training as they grow, and then as they age out, things that they are going to do beyond 21. Covered services include special education, physical, speech, and occupational therapies if needed, any and all accommodations and modifications that the team may find that will be beneficial to the student, aids or services such as adaptive equipment, such as computers that might have talk to text or different There are other options. Families with a child with cerebral palsy, families who have this, they face many difficulties and challenges. The child will need provided constant care. The family may qualify for support from a visiting nurse, home health aide, or respite care. They may require help from friends and family. Many government programs are available, including CHIP, SSI, SSDI, and Medicare. There are support groups available, such as March's Dimes and Reaching for the Stars. There's many books and many online resources today that are also available to help the families understand what cerebral palsy is, where they can go for help, and what their availability is for different things. Sometimes they don't understand all the things that are available to them and the child. Difficulties for the family with cerebral palsy. There's a large amount of anxiety, stress, and depression. That is the main mental health difficulty that they find. There is financial strain. There's lots of medical bills with constant care. There's just many things. Relationship challenges could happen also between the mother, father, the children. The child with cerebral palsy will need a lot of extra attention, and that could cause some issues with any other children that may be in the family. Therapy can be provided for not only the child, but for the family. There also may be behavior problems that could be seen in the child. The earlier that these are addressed, the less difficult they may be as the child grows. Some help for the family could be Summit County DD, Ohio Coalition for the Education of Children with Student Services, and there's advocacy groups that are out there to help the families. The laws regarding this. IDEA guarantees a free public education in the least restrictive environment possible. That means it is going to be based on the student, whether they need inclusive classroom, where they'll be out with general ed kids, resource room, or even the special ed room. That, again, will all be based on the team put together for the IEP. But there is guaranteed access to all public places. They have accessible air travel and transportation as a guarantee. Ramps, elevators, or lifts are required in all public places. Housing must be available to them. If there is accommodations that need to be made in the home for the child or the adult, this is required by law. And if they find that they have been discriminated against, they are allowed to pursue vindication. Testing of a student with cerebral palsy done in school, only a small portion of students qualify for alternate assessing. So most of the students will take a state test with other students. The IEP team will complete the Ohio alternate assessment for students with significant cognitive abilities. This is to see if the student qualifies for the alternate assessment. Just because they have cerebral palsy, it does not mean that they have an intellectual disability that will require them to be alternately assessed. If they are not alternately assessed and they have to take the state test and they do not pass it the first time, they are required to take it a second time. If they still do not pass, the school can set up an alternate path. I know at the school that I currently am a paraprofessional at, we offer job training and job skills and job availability. So these students are able to go out and get job training. I have students who currently have graduated and they have jobs at hospitals, Giant Eagle, restaurants, different things. So we give them that career focused path that they can go down. Curriculum for students with cerebral palsy. There are accommodations and modifications, both that will be added on the IEP for the student depending on their needs. Some of the accommodations are ramps and elevators, of course, wheelchair access in the school if needed. If the child is having trouble walking from one class to another, they may be in need of a wheelchair. Extra time could be permitted between classes. So if a student is going from one room to the next, they might be able to leave 5 minutes earlier so that they're not in the hallway with all the other students, or just to give them extra time. Assisted with carrying lunch trays and books, aid services, assistive technology or adaptive tools, extra time for assignments, all of these things, maybe verbalizing answers, different things. Some modifications are simplified lessons. This could be including less problems, answering yes or no. They might be able to tell you things and then you type. These are different things that could help with schoolwork. In phys ed, lighter equipment, slowing down the moving objects, placing the ball at the student's feet. A few years ago, we did have a child with cerebral palsy. He was able to kick, but the ball had to be placed on the ground. He was able to walk and run still at a slower pace. And if he wanted to throw a ball, he was not able to really grab a hold of the basketball, so we would give him a soft foam ball that he could use. This is a list of my references, and I hope you had fun learning about cerebral palsy.